Welcome to the Change Life Destiny podcast, where healthcare is being reimagined one conversation at a time. We spotlight the people, innovations, and ideas moving us from sick care to self-care and from reactivity to true prevention. This season was recorded live at the CLD conference, a place to connect, learn, and build a new future together. Get inspired at changelifedestiny.com. Let's dive in.
Hello and welcome to the Changing Life and Destiny Conference here in Dallas, Texas. I'm your host, Dr. Chris Motley, host of the Ancient Health Podcast, and we already became buddies already. It's Dr. Toni Engram. She is a biological dentist here in Dallas. She's basically an original. Loves Texas, loves everything about Texas.
I do.
We talked about Buc-ee's. But one of the things I'm really thankful, this is so last minute, we were talking about that when we come here, it's like, hey, would you like to come on a podcast? And we're like, this is going to be awesome.
Yeah.
Thanks, though, for coming in at such a quick minute,
Absolutely. Absolutely. And I'll apologize in advance. Like I said, I normally prepare for podcasts ahead of time.
And who are you? Why are you here? No, I'm just kidding. No, it's totally great. I love it that we don't know much about each other because I think it becomes more honest and real, like in our conversation.
Yes,
right?
Yes, we can learn along with the audience.
Definitely. So we're people love a new person to meet. And again, thanks for coming on here. When Roxy said that we could talk with somebody that knows about everything oral and teeth and gums. To me, I was just telling you, I take that very seriously. I've been in practice a little over 20 years, and in Chinese medicine, some individuals use EAV machines where they measure what they call like a volt electrical points around the gums. Mm-hmm. And what it does is it tests if a tooth is related to an organ. I remember, this is about, I'll say 12 years. 8 years, and it was about 12 years ago or more. And I would notice that some individuals would come in and they would just have like one tooth that would always have like a cavity. Mm-hmm. And they would always say something like that to me. Mm-hmm. And they're like, Doc. And I'm like, dude, I do Chinese medicine and acupuncture. And then I knew a guy named Dr. Tom Lokensgaard. He was another doc in the area and he did these EAVs. And they would talk about measuring electricity off the tooth or around the gums and the meridians. And sure enough, I found out this one patient had a stomach meridian that was off, and they had H. pylori. And I was like, in my heart, H. pylori bacteria, I was like, that's amazing. And
right.
That's why I delved deeper into more Chinese medicine, more acupuncture, of course. I mean, I just really try to study those things.
Yeah.
It all starts in the mouth, in my opinion. And I want you to talk about, thanks again. I just went on that whole story, but thank you because I love this subject.
No, I love that. And I love how in recent years we're really seeing a convergence of Eastern and Western medicine, where Eastern medicine has known these things for forever, for thousands of years. Now Western medicine is starting to catch up. And so we can see the evidence in the peer-reviewed literature, these connections between systemic illnesses elsewhere and problems with the teeth and gums. So I love that Western medicine is finally starting to catch up and smarten up a little bit.
Yeah, it's really, when you look at how in Chinese medicine world, I always say that even Ayurvedic is that if they had the capabilities of doing like surgeries or procedures, they would have done it, but They didn't have the terminology to describe what they were doing back then, or they didn't have that terminology. And so to me, it's always impressive when I find the connections.
Yeah.
And so, okay, before we start off, I want to know more about you. You were telling me some things,
okay.
But you have a great following on Instagram. But people out there, when we do this, I want to know more about you. So tell us a bit about yourself.
Yeah, well, like we were talking about, I'm local. I'm OG Texan girl for I don't know how many generations, but I do love Texas, and grew up in a small town about an hour away from here, and did college here in this area, live and practice in this area, and as I was growing up, I had a lot of people in my family were in healthcare. I knew I wanted to help people, and dentistry was really a good family-friendly career choice for me. I had a boyfriend at the time. We're married to this day. We've been married more than 20 years. So I had a boyfriend, and dentistry allowed me to be able to go to school, help people, have a great career that was maybe a little more, had a better schedule than on the medical side of things. So I went to dental school, and I just wanted to be a normal dentist.
Like nothing like biological.
No, this was not in my wheelhouse at all. In fact, in dental school, they warned us about those crazy people who wanted to take out amalgam fillings, and the people who didn't like fluoride, and they were all the crazy ones.
Really?
Oh yeah, for sure. So I for sure didn't want to be anything like that. But life happens as it does, and I really feel like God led me on this journey to where I am now, and still growing, as you know. Like we're always growing and learning.
Yeah.
But God gave me the blessing of getting really, really sick.
Oh.
So it was around 2010, 2011. I was working full-time as an associate dentist. I was opening my first practice from scratch. I had a toddler at home. I was really just burning the candle at both ends, and started having like some GI issues, and they kept getting worse and kept getting worse. And the doctor was like, I think you just got some IBS. Here's some peppermint tea. And it kept getting worse, started losing weight. And I was not trying to lose weight. And so finally was diagnosed with Crohn's disease.
Oh, heavens.
And, finally got doctors to listen to me enough that they said, okay, let's do a colonoscopy and let's actually look under the hood.
After you had to make the suggestion.
Absolutely. Because I was bleeding when I go to, things were bad.
I have blood in my stool. Can you please give us a test? Yeah.
Yes. Oh. So when they found the Crohn's disease, woke me up from the procedure. I was like, I'm kind of surprised. You've got a good bit of damage in there. And here's what we're going to do. We're going to put you on this list of medications that you're going to be on until they stop working. And then we'll put you on stronger medications until they stop working.
Oh, my word.
And then at some point, there's a good chance you might need surgery to remove all or part of your colon. And as I am 30 years old, I've got a young family. I'm starting this business from scratch by myself. I just thought that was a crap answer.
Yeah, it is a crap
answer. I just did not accept that answer. And so I started doing as much research as I could to try to figure out how to actually get well. I took the medications because I was scared not to. I really wanted to get better fast. And thankfully, the medications did put me into remission pretty quickly. So that then I had the bandwidth to figure out how to actually heal so that I could get off of those medications. And really the long story short is that as I was healing and as I was finding the pathway for me to get better, I knew my diet had to be involved, even though the gastroenterologist looked me in the eye and he said, Toni, your diet has nothing to do with this. A GI illness, isn't that something?
Good gracious.
I saw so many correlations between what I was trying to heal in my own body and what I help my patients deal with every day. So Crohn's disease, yes, it's an autoimmune condition, but it is very inflammatory and it has a lot of gut dysbiosis that's involved. I treat tooth decay and gum disease. I treat inflammation and a dysbiosis in the first part of your gut. That's what I do every day. So as I was feeling better, I really said, okay, I have to learn how to do this for my patients too. Otherwise, what am I doing here? Yeah. And at the same time, I was in a model of practice where I was what I like to call the drill, fill, and bill model of dentistry.
I love it. Drill, fill, and bill.
Yes. And it feels like this hamster wheel where we're restoring maybe the structure of the tooth, but then a patient comes back a few months later and they've got these issues that pop up again. I wasn't really being a doctor of the mouth. I was just being a tooth mechanic and putting things back together. And so having those things happen at the same time is really what led me to dig more into the connections between oral and systemic health. And then it was my patients who nudged me the rest of the way. Like, Dr. Engram, you're talking about nutrition, but how do you feel about fluoride? Have you done your research on this stuff?
They asked you about that.
Yes.
Yowza.
And then the issues with mercury, and hey, what are you doing to protect your assistants and yourself when you drill out that mercury? And so really it was my patients who nudged me the rest of the way into biological dentistry. And
that's how you know when God is like trying to make you learn something.
Yes.
I would think,
Yes.
Yeah, it's like,
yes.
God's like, you're like, well, I never got the sign. And he's like, here you go.
Here you go.
Yeah, push you into that. So they were asking you questions about it.
Yeah.
And when you started to find the answers, what was the steps that you started to implement on yourself? You were going through, did you see some big changes like to your diet, or did you do something to like take some good herbs or anything like that?
I definitely started with diet, and for me it was diet and managing my own stress level.
Yes.
Because looking back, I actually had symptoms of Crohn's disease as early as dental school. I just didn't know what it was.
You didn't know what was happening.
No.
You just that like, oh
Yeah. So it's really important for me, and I make sure I arrange my practice schedule around it, is I have to eat lunch and I have to sit down and actually chew my food. I can't like eat on the run. I have to rest when my body says I'm tired.
Yes.
Like, dumb stuff. I'm sure your audience is way smarter than this, and they actually listen and do these things and know these things. But I was, type A.
Don't put yourself. I'm guilty of it too. So you're type A. You're always on the go.
Yes. Yeah. I did well in school. Like, I was a high performer.
Yeah.
I needed to perform all the time.
So you would be working hard.
Yeah.
Were you the kind of person that would tell themselves, hey, I'm on a roll. I can't get out of this mindset. I don't need to eat right now. Or you just totally forget about eating and you just keep going through the day, have some coffee, and then you're ready to rock and roll?
Both.
Yeah.
Both.
Yeah.
For sure.
Okay, so you're doing that. You finally sit down. You start to eat. You start nourishing your body
With real food.
Real
I cut
food.
out some of the junk. I'll go through phases where I eliminate gluten. Gluten isn't as much of a trigger for me as much as I wish it was, because that would make carb control a little easier. But focusing on real foods, when I'm really needing to be in a healing mode, in a healing phase, then paleo autoimmune protocol works really well for me. And just finding that give and take. What can my body really thrive with? And when can I push a little bit? Because I still like to push.
Yeah, we all have those phases. So
Yeah.
when you are in practice, you're seeing your patients to ask you questions. You're still healing, or you're working on yourself.
Yeah.
And again, so when you go through your practice, I am really impressed with how the dentistry, like the individuals who are like you that study it. Because when you talk about the first part of the mouth, I've forgotten this, that when we talk about alimentary canal, as corny as that term is, it's like the whole tube that goes down is made of the same cells.
Right.
It's literally made of the same cells. So you could have something going on down here, but it started up here.
Yes.
That kind of thing. And so
Yes.
when that happens, and you've learned and you're starting to see your patients, what were they're asking this, what were some of the first things that you were starting to implement, like when you started to see like this is happening in their mouth and I know it's happening down their digestion? Like, what were some of the things you started to see?
The practice was so different.
Yeah,
back
so diverse.
then. It was so diverse. But I would say, a big thing is my teenage patients.
Yeah.
And knowing when they were, not only was their diet crazy, and I could tell they were drinking some kind of soda of some kind or sports drinks or whatever. Yeah. And being able to see that and show them in their mouth.
And show it like
the effects of that. Yeah.
When you show the effects, let's say a patient comes in and they would say you're eating wrongly, but let's say they're eating a lot of different foods, and some family members will say this. Maybe this has a point to, like, what I'm trying to get across. It's that they'll drink and eat something, and they'll say, well, this guy over here, he eats crazy. I don't really get it. He doesn't really get cavities. I barely do something, but like in one tooth or some area always gets infected or has a problem. Do you see that a lot? And does that have a lot to do with like the rest of the body and digestion? Like that one tooth, like a connection to the rest of the body?
Yes, and yes, and yes. So what's really fascinating is digging into patients' microbiome. And being able to see a saliva test and what specific bacteria they have, and trying to put together those puzzle pieces, because it is bizarre and maddening and frustrating if one family member is always getting cavities but another family member isn't, who may or may not have the same habits. So being able to see from a microbiome standpoint exactly what's causing that decay is huge. And then looking at their gut health and saying, okay, yeah, maybe their diet's the same. Maybe they are sharing a very similar microbiome, but for whatever reason, there's some stress and there's some gut issues to where this one person's not absorbing their nutrients the same way. Or their mouth breathing.
Ooh.
And that takes us down a whole other airway rabbit hole, because if they're breathing through their mouth, especially at night, then it really wreaks havoc on that person's oral health.
Really? With the mouth breathing?
Yes, it is huge.
Okay, so I got to touch on that because I have a lot of patients that do mouth breathing. I need to know about that. So if you had a microbiome, that's what would separate normal dentistry. I mean, that's one aspect of it that separates that from biologic dentistry, because you're looking at like the mouth and all the implications,
right?
And how to use like good nutrients and such to help bring out the health in the mouth.
Yeah.
So I'm really intrigued with this. I like asking questions. I'm sorry if I asked too many, but I think
that's good.
When you have the gum lining, and let's say it's a microbiome, my dentist, great guy, shout out to Dr. Ryan Jones, love you, brother. He gives me like oral probiotics.
Yes.
Because he says there's a part in my back area, even though they say, well, you brush. I'm like, well, I do. And they said, well, you need to keep your sonic brush here a little longer. But they said you don't have the microbiome to actually help fight off that plaquing back there. So you have to suck on this lozenge. So I'm starting to do it.
Nice.
And he says, and is that a big thing? Like when we say microbiome, like you're saying it's sort of like this is similar to like down here. Like you have to like treat it almost similar.
You treat it similar, but it is a different terrain.
Okay.
There's a lot of overlap between the terrain, but the environment's different. The pH is different.
Oh yeah.
So they're not the same species, even though there's a lot of overlap and we see correlations. But just like the skin has a different microbiome than the gut, which has a different microbiome than the vaginal tract, which has a different microbiome than other parts of the body. Your mouth has over 700 different bacteria, fungal species. Like there's all kinds of fun little bugs in our mouth. Some of them we want more of, and some of them we don't.
Okay, so you had the bugs. People are gonna like freak out. So if you had the bugs in the mouth, and is it the ratios that get out of alignment with each other? Like there's like too much, and it'll start causing those problems.
Correct.
What are some of the things like in a gum? Like let's say I've had some people talk about deepening, like a receding gum line, and some people say that they've had root canals. I want to talk a little about root canals. Your thoughts on that? People have had root canals. Some people say, well, is it okay if I get a root canal? Can you talk a bit about that? I know it's a lot. I'm sorry to throw that out there, but I get a lot of questions.
I love this because I think my answer is I know it's different than my traditional allopathic colleagues. It's maybe even different than some of my biological colleagues because I think we get into trouble when it's all fearmonger, clickbait kind of stuff.
Yeah, totally.
So I take a pretty balanced, non-judgmental approach
Very
to
even.
root canals.
Yeah, totally.
Very even. Root canals they remove the nerve and they remove the blood supply to the tooth, which can help maintain the structure of the tooth, which has a lot of different benefits for different ways. It saves the space, it maintains the bone. So keeping your tooth is a great thing. But when you do a root canal, then it's essentially this mummified organ that's in the mouth. It's a dead tooth. It is dead. And so what happens is the bacteria that then inhabit around and inside that tooth are no longer the bacteria that thrive where there's good blood flow.
Oh.
They're different species
Wow.
that thrive in low oxygen environments. So I like to say, sometimes it's the low, creepy, crawly, bottom feeder kind of bacteria.
The shrimp of the mouth.
Right, right. And so for some people, that can be too much of a burden. It fills their toxic bucket too much for them. Not for everyone.
Not for everybody,
some people handle it just fine, just like some people can smoke cigarettes and not die of lung cancer.
Yeah, totally. Yeah.
So some people do just fine with the root canals and some don't. So if the root canal, if there's any issue at all, then absolutely we want to make sure that we take care of that and that we do it properly to where we're helping that area heal the way that it should. And I also tell patients, if you wind up choosing to do a root canal, if your only option is to do a root canal or lose the tooth, if you choose root canal, then I want that to be the best darn root canal that modern dentistry can provide. So I'm going to send you to a very specific specialist that has a very specific equipment. They have a microscope. The one that I refer to uses ozone in their root canal treatment.
What?
Yeah. And so we want it to be done really, really well because we want to disinfect that tooth as good as humanly possible.
Yes.
Some people that just doesn't work. They'll either choose, like they don't want a mummified tooth in their body.
Yeah.
And especially if it's in an area of the mouth where there's not a lot of aesthetic impact to losing the tooth, they'll choose to lose the tooth instead. I don't think that's necessarily always the right option for every person.
Yeah.
And I would assume the other practitioners that I am friends with that talk about the teeth importance in traditional Chinese medicine.
Yeah, you don't want to lose a tooth per
Right.
Like it's real. Is that? Because I think about this a lot. So let's say you did get the root canal.
Yeah.
And I've always wondered too. I mean, can you do ozone? I used to always think, why couldn't they do something to keep that root canal really clean?
Yeah.
Maybe it's regular visits. I was like, go get it root. And so, because I always think it's really important for your jaw space because people will get jaw tilt. I mean, I've seen some people when they lose a tooth and then their eating habits get kind of screwed up. And then I was wondering too, like if the current is going through the tooth, but you pull the tooth out, even if the tooth's mummified, I love that terminology. I'm like, I would rather have more, or even if it's mummified, I'm asking myself, like, but isn't that still bone material that there could be maybe possibly some conduction as opposed to just like an implant? So I'm sorry, I'm taking the thoughts away, but
no, and that's a great point. And that's why it's so important that we're all working as a team.
Yeah.
That's why informed consent is more important than ever.
Yes.
Like we need to know what are the pros, not just in your mouth, but what are the benefits to your whole body of doing this procedure or not?
Wow. And do you find that like when you do root canals, some people take it pretty well? Like
For sure.
Yeah.
Absolutely.
Wow.
Absolutely.
And
so being able to have those conversations with patients, I think, is really important because they'll ask my opinion. And so I'll give them my clinical opinion. And then it's really a conversation of how does this align with your values? You know, if you're a 70-year-old man who's got maybe 14 amalgam fillings and you're feeling pretty good, You're not on any prescription medications. You've got another root canal that did fine. What are the chances that root canal is going to be harmful to you overall? Probably less than a 35-year-old mom who's got another autoimmune condition already. It's being
totally,
able to
sense.
look at the person as a whole and have that conversation of, okay, what are our actual risks? What's the benefit? And help them weigh that out, hopefully with their other practitioners too.
I see that too, because I thought if a person had a root canal done and they got it cleaned out properly, and I understand they'll say, well, the electrical conductivity to the tooth could cause some positive polaric changes that could lead to cyst or tumor formations. That's what some of those thoughts are. But again, stop me if I really am thinking this through. If a person had a tooth, they call it neurological tooth, right? We want to talk about that. If they had a root canal done on that tooth, I always thought they cleaned it out properly, and then they cleaned the organ out that was related to it. I'm like, wouldn't that keep that area of the mouth clean? Because like if the tooth is related to the stomach has some infections, clean that area out, maybe clean the stomach out and keep it. I mean, it would help the root canal stay pretty stable, I would think.
I would think so, but it gets tricky because when you say clean the root canal out pretty well, we're taking these tiny little micro instruments and going into root canals that are, the size of a few strands of hair. But that doesn't include all of the little accessory canals. Your teeth are like a sponge.
So you have like small little canals in the whole area.
Yes.
Well, okay. Yeah, this is a big subject matter. So I'm glad you have this open mind, because I've always wondered if some of them are okay to do.
Yeah.
With this, though, and the mainstream, because you'll hear a lot about how, root canals are completely evil and they're not. Well, it's
right.
It's just you have a specialist that goes in and cleans the tooth out and such. So it would be a good thing to find a biological dentist that can see both ways in both arenas.
Right.
So when we have root canals, try to find somebody that could work with informed consent about what you're comfortable with. Is there can we talk a little bit about cavitations as well? And some people of my patients have had their wisdom teeth taken out, and they talk about open wounds. I had them where we had to wash them out.
Yeah.
And then now they have said, like in the last years, they really are paying attention to small cavities within the jawbone. Can you talk about cavitations and what they could imply and how to help them?
Yeah. And what's interesting, for some reason, it's controversial in allopathic, in more traditional dentistry. They don't even like to say that word.
Really?
Yeah. It's weird to me. I don't quite understand it. But you can have what most people in the holistic community call a cavitation. In dentistry, we would say, maybe a traumatic bone cyst, or some neuralgia-inducing osteonecrosis of the jaw. Sometimes it induces neuralgias. Sometimes it causes symptoms, but a lot of times it doesn't cause symptoms. But you can still have necrotic areas of bone where, for whatever reason, if the immune system wasn't quite optimal when those wisdom teeth were taken out, then the bone doesn't heal the way that it should, and you can wind up with these little necrotic areas in the bone.
Yeah.
And that can definitely throw off patients' meridians, throw off their currents, it throws everything off. And so we take care to, when we find them, again, weigh out our options with patients. Sometimes we're just doing some ozone treatments in that area. And then sometimes we really will go in and we'll remove that bone cyst. We'll physically clean out the area and send everything to pathology lab, see what's going on, and then give the body what it needs to then start the healing process over and heal the bone correctly.
Wow. So like when you have the bone cyst or something occurring in those areas, why is it so hard? I mean, I've heard that they're limited blood supply to around the gums and the roots of the teeth. Like, why is it so hard when you see a cavity or you have an infection in the gums, they say to clean out, because is it hard for the white blood cells to get to the air, or is it hard for it to drain, or is it hard for like the areas of the lymph to drain around the jaws? Is that why it's so important to try to clean these things out?
I think lymph is really important with any kind of oral infection, because we do get a lot of congestion in the lymphatic system. And so that can play a huge role. I think really it's just that it's such an integral part of the body that's constantly exposed to the outside environment. So it takes more effort sometimes. It takes more work to get and keep it healthy, because we're just constantly exposed to everything in this world that we're exposed to.
Truly, like, because I want to talk about the open mouth and breathe through the mouth. So if we had infections getting to our gum lines, because that's our first line of defense, basically. When you talk about, like, what kind of infections? Can there, like, be certain types of infections you get in your food? Because I've heard people say that you can eat, of course we get parasites and such. There's certain types of mold and such. Do you see that as, like, it's our first line of defense? So we could have a biome or something that needs to be really strong, so whatever we eat, it can fight it? I
would say food, not as much of an impact as other people. So tooth decay and gum disease are communicable diseases.
Gross. Just kidding, it was a joke.
Right? I mean, it kind of is.
And like, you're a jerk.
I really
Molly.
make sure to tell my teenage patients that it's contagious. Just in case, sometimes teenagers need just a little extra encouragement to take care of things. And so if we can motivate them.
Yeah. Oh, Bobby over there's got some gum disease. I would not make out with him.
Or, hey, do you want to kiss that girlfriend anytime soon? We might want to make friends with the toothbrush and floss.
No, totally. I've had times when patients have come in, and there could be, like, truly, this is how I think about it. If they, like, a patient, boyfriend or girlfriend, always had consistent cold sores or canker sores, and they would show signals through some of my testing. I'm like, I think you do got some, like, viral issues. You may want to get a test done. And then I would automatically ask her, like, do you have a boyfriend? Da 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 da. And they're like, well, yeah. And I would normally assume that if a virus can hurt a nerve, because that's what viruses love. They love to go on nerves. I'm like, if you get a cold sore, it's going to go after the nerves. And I think, like, that's why people say, well, I have jaw pain, or nerve pain. I'm not saying it's the only cause, but when I have a person that says they have a boyfriend that does that, I said, you need to get that guy cleaned up.
Yeah.
Just for the possibility.
Yeah.
Right? I mean, if I had a daughter and I saw that, I'm like, you better never. I'll tell you that right now. Not because I'm not saying you shouldn't kiss the guy. I'm just like, you need to get that cleaned out.
Yeah.
All right, I'll stop getting on that soapbox. So it's communicable.
Yes.
And you can get infections. That's why people ask that stuff. So, like, what kind, like, all types of infections can be transferred, right? Oh, okay.
Yeah.
Could somebody have an oral? I've seen that, and yeast on the tongue. Can yeast be transferred in the mouth?
Yes, it sure can.
Oh my goodness!
Sure can.
I will tell you a funny story. I know you have these, and please, I'm not trying. This is your show.
Will it be gross?
It's kind of gross.
It's even better.
Okay, so I have a friend of mine, and I knew that she always had something that was going on in the back of her adenoids. And I kept finding these signals. I said, I think you have some form of strep or a staph. I think you need to go get it checked. But she couldn't drink something or eat something, and she would feel something get caught.
Okay.
And I said, I think I kept checking her gums, and I have an EAV. I was doing some testing. I said, I think you got something right here. So she goes to a biological dentist, a great one down in Alabama. They find out she has a pretty big cavitation area, some swelling and such down there, and some infection. And then she had mold issues. Fast forward, they finally did a different type of CT scan on her throat. And I was like, I kept finding signals when I was doing these palpations, and I do some biofeedback, and I was like, well, there's a frequency off this point for H. pylori. And when you know it, They did an H. pylori test on her. She had it, and she had one of those like esophageal, pockets growing on the inside, like it had deterioration, and she was catching her food in that area.
Oh my gosh.
So she did that. I was like, okay, well, that's a good find. Like, just like keep on. The doctor's like, well, we got to find out what's going up here because it was he said it was draining down here, and they opened it up, and there were little parasites. He found them. He scraped them out. Little worms in her jaw.
Bless her heart.
She had two little cysts that were like 2 gangrene cysts come out, and they showed it. I was like, what?
Oh.
And she, and thankfully though, it would be sad, but she was like, well, at least I know now.
Yeah.
And when I saw that, I just saw the power of like biological dentistry. And she goes, I'm not 100% cured. He goes, but 80% of my stuff is better.
Wow.
Isn't that cool? And when they cleaned it out, they found it. I always tell the group here, I'm a nerd about certain things. And I said, well, for everybody out there, like we talk about neurological tooth, each tooth has like a connection neurologically to an organ. Mm-hmm. And that little area was her lungs. And she'd always had grief issues with her father and stuff like that. And I was like, and I'm not saying it caused it. Mm-hmm. I was just like, I didn't even say, I was like, do you always have grief issues? She goes, yeah, ever since I was really little. I think there's a really cool connection how the teeth are everything's really interconnected.
Isn't that fascinating?
It's so cool.
I think it's interesting to just how little we know.
Yeah, totally.
How little we actually know compared to how much we think we know.
I'm with you. I think that when we look about certain patterns, especially like how important the teeth are, I feel like even in Chinese medicine, when they say, well, you know a little bit, doc, and I go, I hadn't even scratched the surface. When I try to read a book, I am not, when I look at something, I go to the conferences and they'll tell me something and I'm like, oh my word, I missed that for the last 20 something years.
Right.
But this is the time you learn it, I think.
Yeah.
So, oh man, I had to go down that story because I love when we talk about it.
That.
When we talk about cavitations, we've talked about root canals. Mm-hmm. And when I got to make sure we get this in before the end of the podcast. What about mouth breathing? What's going on with that? Like people say they do mouth tape. They say what's this whole situation? I want to hear.
Yeah. So we need our mouth to be closed and our tongue to rest on the roof of our mouth for all kinds of things. In infancy and in childhood, we need it to actually help our jaws grow properly.
No way.
Yes.
With the tongue up on the roof of the mouth, your mouth closed.
Yes. And we also need it to produce adequate amounts of nitric oxide to protect our heart.
What?
So nasal breathing is incredibly important. Mouth breathing wreaks havoc. From not just an overall health perspective, but when you breathe through your mouth, specifically at night, then it dries out the saliva, and the saliva is what protects you from those fluctuations in pH that can damage the microbiome. The whole biofilm of the mouth will shift if you're mouth breathing regularly. And so we'll see huge increases in tooth decay and gum disease, gum inflammation if somebody's breathing through their mouth on a regular basis.
So would you recommend like the mouth tape? Is that one of the biggest things that you like, or a guard?
I would say I really like mouth taping as long as you're able to breathe through your nose.
That's why I've always wondered if they do have a nasal issue, like don't do it. But...
Right. So I usually tell people to try it for a few minutes in the daytime. Test it out for 5 or 10 minutes. See if you can keep it on. See if it's habitual, or if you really do, if there's something anatomically going on. And in our office, if we're doing a 3D type of scan, then we can help with that some. But yeah, we want people to test it out first.
So they could, if they do keep the mouth open, it makes me really suspect, because I've had patients, and truly, I know they had sleep apnea. So sleep apnea is a big thing, and
huge.
And I've noticed those patients I'm not judging anybody. They had a little bit smaller chin. All of them. So jaw development is like with the tongue up on the roof of the mouth.
Yes.
When we start to see that mouth, we can tape the mouth. we correct that with the whole new, there's a lot of new studies about strengthening up your jawbone. People will like do like jaw exercises.
Yes.
Is that right? To make your jaw bigger? Is that right?
Yeah.
Does that work?
I personally have not experienced this firsthand, so I would it's for sure not going to hurt anything. If you're being smart about it. Like, I don't know that everybody we see on YouTube and TikTok is doing it in a smart way, so be careful. Don't break your teeth off or anything. But in theory, in concept, yes, chewing, making your jaws work to help build the musculature around the jaw is a beneficial thing.
Wow. Okay. So do you recommend to all your patients, I'm asking, like, you do a good x-ray or something, or but like cone beam scans where they go and they do you do that regular on patients, or just like on special occasions? I
like to do it on their first visit, and then if there are issues that we're looking at, then we might do it more often, every year or two. But in general, I like to do it first visit so we can see everything in detail, and then every 5 years or so.
Wow. Okay. So like with your patients, I think that as you start to clean up, I know you have, but people out there listening, when people say I have digestive issues, when you started cleaning up their oral area, did they ever come to you and say, hey, like my stomach stuff's starting feeling better, or like these other areas of my body are starting to improve? Have they ever done that?
Yeah. And you want to know what's crazy is I've experienced it myself.
Oh, really?
So there was a saliva test that I was trying out on myself for the first time in a while, and one of the strains that it picked up, I can't remember exactly what strain it was, but it was flagging gut health as a concern with that particular strain of bacteria. I was like, oh, that's weird. My history of Crohn's disease, that's something I want to pay attention to. And sure enough, just a few weeks later, I started to have a few little digestive issues creep up. Yeah.
Yeah. See, this is the stuff, like, it's communicable.
Isn't that crazy?
Like, it does. Okay.
Yeah, and it
transmits, like, is there like a communication between like the oral stuff all the way down?
Yeah, you're swallowing it. Yeah.
Wow.
Cool, right?
I know. We had to have more conversations. There's not enough time.
We're just gonna have to do it again.
Yeah, we have to. There's not enough time. Okay. All right. So
I'll see you next week.
Definitely. It's gonna be. This is really, really interesting to me, because I would love to talk about like the communication patterns too, like the quorum. I've heard, like, bacteria communicating. Okay. So this has really been great.
We haven't even talked fluoride yet.
I know, but we're right at the time.
We don't have time.
Okay, let's try to do this again, okay?
We'll
Seriously.
do it. Okay.
We'll talk about fluoride. All right, tell everybody where to find you, what's your website, how people can get in contact with you, work with you, or however you want to be worked with.
Yeah. So I'm local to Dallas, Texas, so my practice is in this area. The name of the practice is Flourish Dental Boutique. So our website's flourish.dental. You can find me, probably Instagram is my most active social media, and that's at Dr. Toni Engram, and that's Toni with an I, Engram with
not
an E.
Not a Y and an E. So, okay, I'm a goofball, but no, it's really been great having you on here. I know we just met each other, but this has been fun. I mean, and we'll have more. We got to talk about fluoride, all right? So,
yes,
guys, from all of us here, Changing Life and Destiny, thank you, Dr. Toni Engram with an E. Until next time, we'll talk to you guys soon. I'll see you.
That's a wrap for today's episode of the Change Life Destiny podcast. If you loved what you heard, share it with a friend and follow us for more bold conversations and breakthrough ideas. Ready to take the next step? Visit changelifedestiny.com to join the movement. See you next time, and keep diving in, learning, and leading the change.